Hello, and thank you for joining us for KPMG's LinkedIn Live series. We're joined today by Mary Dolan, who led the Workday implementation at South Shore Health. And she's going to share some wisdom and insights into how to successfully implement full platform Workday, HR, supply chain, and finance in a completely virtual fashion. We're also going to share with you some insights into what we see our clients doing in response to COVID. And really that fits into three primary areas. First, how do we bring our employees back to work? Second, how do we change the way in which we work? And thirdly, how do we recover financially? So let's start with the first set of trends and observations that we have. The top of the list is how do we bring our employees back to work? And we see our clients doing some really innovative things. At the top of the list is the creation of a WorkPass app that allows employees to respond to a series of simple questions about their health, about the health of those around them, and certain information that helps us assess the risk to transmit, the risk to contract, and the community threat level overall. By answering these questions on a daily basis, the employee receives a green, yellow, or red rating that allows them to determine what kind of work and from where they can work on that particular day. So if they happen to have a temperature that day, their rating would be red and they would be prohibited from coming into work. If they had no symptoms, but they had a family member who might have been exposed to COVID, they may appear as red or yellow, and as a consequence, be restricted to working in only a particular part of the office in an independent fashion. And a green rating might mean that they could work anywhere in the office, even in a collaborative fashion, provided that certain PPE and social distancing standards are adhered to. That's one very innovative idea that we see for organizations that are needing to bring back the workforce and are looking to do that in a way that helps them mitigate risk. Beyond bringing back the employees to the workplace, the second thing that we see organizations working on most is changing how they do their work. That includes everything from changing the services that they actually deliver. In the healthcare space, we see a rapid escalation in telehealth. Organizations that 5 months ago had just a few telehealth transactions every day now have dozens or hundreds. And so we see many organizations are focusing now on what kind of technology do we need in the patient's home, be it cameras, be it diagnostic technology, to effectively deliver telehealth to our patients. That involves also training the workforce on how to work and deliver care in a telehealth kind of a capacity. The third area where we see organizations changing how they work is in the area of managing and measuring people. In the past, it was easy to see someone working and to know whether they're productive or delivering to the expectations. Today, when we're working mostly in a remote fashion, we have to shift what we focus on from activity to outcomes. And that requires us to completely rethink our performance management approach. And finally, a broad change in technology. How do we ensure that we have the right connectivity, the right VPNs to protect patient data, customer data, employee data? Those are all technology questions that our clients are thinking through right now. And finally, organizations are rethinking how to recover financially. The good news is that when you change the way in which you work, frequently there are financial benefits. Our early surveys show that employees are more productive working from home than they are working in the office. In that area of how we recover financially, we also see organizations changing the the way in which they operate, and they run their middle office and back office functions. For example, we see many organizations in healthcare rethinking how they schedule appointments, to reschedule all of those appointments that were for elective surgeries and other procedures that were that were canceled in light of COVID. We see organizations rethinking HR, IT, supply chain, and finance work delivery, looking at ways to standardize and simplify the work, looking at ways to centralize the work and perform it in a more efficient fashion, and ways to automate the work to reduce the cost of those processes and to make them more consistently effective. So technology is pivotal to the success of both transforming how you work as well as improving financial results. And with that, let me turn us back to our conversation with Mary Dolan, who leads the project, who led the project for Workday implementation at South Shore Health. Mary's going to tell us how they went live with HR, supply chain, and finance technology in a 100% remote fashion.
My name is Mary Dolan, and Viktor and Jarrett, thank you so much for having me. I'm the Executive Director of the Enterprise PMO at South Shore Health outside of Boston, Massachusetts in Weymouth. And I oversaw the Workday implementation for us. And so we are officially live and in the stabilization period, if you will.
Hi, everyone. I'm Jarrett Goodman. I was the overall program manager from the KPMG side for the Workday implementation at South Shore Health. So for all of you, I was Mary's partner in crime, and we worked together to pull this project together. So Mary, is it okay if I ask you a few questions now?
For sure, let's do it.
The first question I have is, can you speak a little bit about where we were in our Workday implementation when COVID really started to hit and some of those changes took effect and started impacting our project?
Sure. So we were days before go live. So we officially were a big bang implementation, but we had 2 go live dates. So our first go live date was HR and payroll, and that was March 15th. And then we did finance and supply chain on April 1st. So if you think back, I know it's hard to do that sometimes today, we don't know what day it is, but March 15th was right as COVID was really, at least in the Northeast, in Massachusetts where I am, was really taking off. We were standing up our incident command, our testing centers for COVID. So it was literally days before the implementation that COVID really became a bigger reality for us. And, so thinking for both the HR payroll pieces and then the finance and supply chain pieces, we actually we were going in waves. So it was really interesting to see how we kind of checked and adjusted as we went through what was going on with COVID and then how we needed to handle our go live.
I know you had a pretty interesting first reaction when we first started speaking about COVID. Can you share that with the group?
Jarrett's saying interesting because I was screaming at him. So that was the initial reaction. So when we kind of started talking about, okay, what does this look like for us? Jarrett had a conversation to say, I'm not sure that we're going to have people physically on site. And as a person who works in healthcare, our world is where we treat patients, and maybe not necessarily in IT or in HR or finance or supply chain, but we certainly make sure that our number one priority always, regardless of what your role is in healthcare, is the patient and the people caring for the patients. And so when we started to think through to say, okay, we're not going to be physically in a command center, what does that look like? We definitely needed to adjust. And that included myself, adjust my thinking, because I think initially my reaction was, we're healthcare, we show up, it doesn't matter what's going on in the world. And so it went in phases a little bit. And as everybody who is dealing with COVID knows, we were learning things on an hourly basis. So my initial reaction was, you guys better be on site. I don't care what's going on, get here. And it kind of went to, okay, you don't have to be here, but we're going to be here. To then it eventually morphed into, we're not going to be on site either. And that changed our model. And you know, I had spent with our awesome facilities and engineering and IT teams, we had spent weeks setting up a command center at the hospital. And so the first stage, at least for us, was, okay, you can't be at the hospital, but we'll be at an offsite location because you'll have visitors. So we moved the entire command center to a different location. And then again, like I said, we then went and said, ooh, we're not even going to have a physical command center. We're going to go totally virtual, which was the first ever in my career.
So once we got past your first initial reaction to having a remote go live, can you talk about how you partnered with KPMG to address our virtual delivery of the remainder of the project?
Yeah, so, you know, based on as my attitude shifted also to saying, okay, we're going to be completely virtual, it was, how do we do that? So in my whole career, I've only ever done implementations, and I've only ever done implementations in healthcare. So that model for us really is a physical model, typically in the world that we knew. And so it was, okay, let's get creative. How do we make it work, recognizing everybody is going to be not in the same place? We're supporting a, you know, business mission critical initiative. So if something goes wrong, how do we address that? And then additionally, we might have people in different time zones. So how do we account for that? So it was really, really interesting. And thanks to KPMG and Workday for coming to the table to say, let's get creative. So how do we do this? If we aren't physically able to sit shoulder to shoulder, if you will, how do we troubleshoot issues? If we need to map something out, how do we do that? And we were able to come up with a true virtual command center. And what I mean by that is we had screen sharing capabilities, obviously, where we would the entire project team would get together and we would say, okay, this is what's going on for the day. We did our change controls. With our implementation with KPMG, we had kind of a collaborative tool that they utilized, and you guys would have to give the exact name of what it's called, but it was a tool that we used to share information the entire implementation. If we hadn't had kind of that we called it PEZ, but if we hadn't had that, it would have been more difficult to, I think, track the issues that we were having or the cutover activities that we were going through, because we were able to essentially web exit or Zoom, whatever that we were using at the time, to share it, but then also people could real time outside of those meetings be collaborating on it. So I think that was a huge win for us and something that would have been a little bit more difficult if we hadn't had that capability. So we did have several meetings throughout the day virtually via a kind of sharing tool. But then also we had, and thanks to Jarrett for splitting time with me because I know it was tons of fun, but we had the ability to kind of come together to say, okay, we're going to quote unquote sit, it was sometimes in my pajamas in my living room, in a command center where people could come in and say, hey, we can't get a hold of so-and-so, or we need help down here, or whatever the case may be. So we had a presence. The presence was just virtual. So it was all the things we typically do when we're in a physical command center. It just happened to be that we weren't physically there, and it ended up being a huge success. You know, I can't say enough good things about the partnership that we did have. And I think without that partnership and the ability to be transparent and allowing me to work through my emotions maybe a little bit with KPMG and Workday, I think without that trust and without that ability to do so, we wouldn't have been as successful.
And Mary, it really wasn't just your emotions. They were shared emotions. When I think about my conversation with your manager, Kara Babachikos, the CIO, there was a similar first reaction. I recall being on the phone with her to share this concept that we may not be able to travel. And her first reaction was also quite emotive and not positive. But the next question that she asked me, I thought was really the turning point. she said, just as you did, what can you guys possibly do to make it feel like you're sitting next to me, looking over my shoulder as I'm fixing a defect or working through some sort of an issue? How can we do that? And I said one thing, and it caused like a long pause in the conversation. What I said to Kara was, we are in the cloud together. Mm-hmm. Literally, we're sitting together in the cloud. What you're looking at, we are looking at. What you're trying to solve, we can see you solving it real time as though we were sitting next to you. And as soon as I said that, she just rewrote 20 years of experience implementing large systems in those 10 seconds to rethink what's possible. And that was amazing. And she came back and her tone of voice changed and her total attitude changed from, heck no, there's no way this can work, to, okay, let's figure this out.
Yeah.
So hats off to you and to Kara and the team for taking a tough situation and allowing these great tools like the Powered Execution Suite, the fact that Workday is in the cloud, allowing those solutions to actually take. Because without that change in thinking and support, even though the technology would have been there, you wouldn't have embraced it. So hats off to you guys for embracing this new normal.
Yeah, the crazy new normal, that's for sure.
Indeed.
Yeah, I mean, to that point, Mary, while we were all in the cloud together, you know, there were some challenges we faced shifting real time into this remote go live. So can you maybe talk about some of those challenges and how we overcame them?
Yeah, so I think we had to take time to change day to day too. You know, implementations are stressful and they're, you know, people are anxious as it is. And then you add the complexity of not knowing where people are, not knowing where they could be, and how to get a hold of them. So it was really kind of shifting the mindset and playing day by day to say, okay, what went well today? What didn't? Like, what do we not need to do anymore? Because that just didn't work. And I think we had a lot of those moments. So it's really having that partnership to be transparent with one another, to say this went really well and this spin-off meeting holds a ton of value, versus this model really isn't working and we need to change that. I think, you know, the biggest nerve-wracking part, at least from my perspective in the implementation, was making sure, and I know I just mentioned this, but the patient care is the number one priority, and the people who are taking care of those patients, especially in an ERP implementation, is my priority. So I don't want people to have to worry about, are they going to get paid correctly? Are they going to be able to get the supplies needed to care for that patient? You know, that's my biggest fear and the biggest piece or focus of the implementation. And so when I think about the challenges, and I know you two are very familiar with this, right before April 1st, which was for finance and supply chain, I came to you guys and I said, I'm really nervous about supply chain. And I'm not nervous because I know our supply chain are rock stars and I know our team is going to do whatever it takes to get the job done. But they're so focused on getting the right PPE for our facility and for our employees and our colleagues. You know, but what if the system breaks? You know, like I don't want them to have to worry about it. And so when I think of what was the biggest challenge, I think it was coming up with creative solutions that we had never experienced before in any capacity, to say, okay, well, if the system does break, this is what we're going to do about it, because we're not physically there. You know, we can't be going out and physically helping the supply chain folks. So I think the biggest challenge in my mind was really coming up with those creative strategies to manage the work and manage and make sure that we were comfortable with what our approach was going to be. And then every day kind of looking at what we had put in place and saying, yes, that works really well, or, whoa, that doesn't work so well, and we need to potentially pull that back. So I think, you know, what was helpful was the ability to think a little bit creatively and, you know, just throw out ideas as a project team and with KPMG and Workday at the table to say, this could work, let's try it. And being able to be flexible and creative. So I think the challenging part of that was it was just unprecedented. This is not something that we do every day. Healthcare folks are always ready for the unexpected. And so I think that was what served us well, is that we're always prepared for the unexpected. I think this was just unparalleled. So just a little bit different than what we're typically used to.
I'll tip my hat to you, Mary, because one thing that you've done, and you've done it since the beginning of the project, even before COVID, is think 3 or 4 steps ahead in terms of what the risks are and what do we do about them? How do we prepare for them? The risk you just mentioned, which is if my supply chain team is focused on PPE, how do we help them with an unexpected technical glitch? Mm-hmm. There are dozens and dozens of those kinds of what-if scenarios. And I think you guys did a masterful job of thinking through what could happen and having solutions ready-made. And so there weren't too many hiccups that happened that you hadn't actually already thought about.
Yeah, that's the goal for sure. Risk management is always top of mind. And I think it's being able to just think through them, and it's okay. Risks are never bad in my mind, as long as we can see them and we can take action on them, and we as a project team can come up with a solution to address it. You're in good shape. There's going to be risk in everything that we do. And so it's just trying to plan for it the best that we can. And there'll be stuff that comes up that we didn't plan for, and that's okay too. That's why we kind of have a project team in place, and that's so that we can address it.
Mary, I'm also glad you brought up the risk we encountered around, ordering supplies, specifically around PPE at Go Live, because I realized that we brought some unanticipated value in, we had a supply chain team that had experience in other epidemics, like Ebola, and we were actually able to connect your team and talk about ways to get creative and work on ordering supplies. I know there was a point where we entertained blockchain, but it wasn't possible to do in time to actually allow value in PPE. So it was certainly interesting, and it was something we took to heart. We wanted to make sure, the hospital could continue to function the way it needed to, and there was no issue with our Go Live. So thank you for bringing that up. I mean, so Mary, it sounds like you made a pretty big transition from your initial reaction to where we ended up, and obviously you guys are live now. So do you want to talk about the outcome and how Go Live actually went for you all?
Yeah, so anybody who tells you a Go Live is perfect is lying. So I'll start off by saying that. So overall, our Go Live was extremely successful. Was it perfect? No, certainly not. There were always things that, in any implementation that I look back that I did, I would change if I could. And so I think overall though, and it's because of the amazing work of our project team. So I will say that, and our organization kind of supporting this critical initiative. So we were successful because of the project team and because of their hard work and dedication. It had nothing to do with, as much as I would love to, it had nothing to do with you and me, but it had everything to do with the work that the project team put in over the past little bit over a year. So I will say that the implementation was successful, and that it was successful in my mind for a couple of reasons. One is, especially as we look at it holistically, so I'm thinking of it across the board for HR, finance, and supply chain. So one is that we were able to pay everybody correctly. That was one of it. And I know Jarrett and Viktor are laughing because that was like, I would come into every meeting being like, okay, how are we doing with payroll? That's my biggest concern. Selfishly, I also like to be paid correctly. So that's a big, piece of it. So I think that is one, and that's because, again, as I mentioned, we want the caregivers to be focused on the great care that they provide for our patients every day. We don't want them to worry about anything else. So I think that's one. And then the second is really, from a success standpoint, is the supply chain in general. So I cannot say enough amazing things about our organization and the work and our community that we're in, who were donating PPE supplies and other things for our caregivers so that they could, again, focus on the care that they were providing. But it's a pretty amazing feat if you think about it, where the entire supply chain division was focused on getting PPE equipment, and they also transitioned, they transitioned to a completely different system. That speaks volumes, you know, and they were focused on really just making sure that everything was up and running. And even though we had issues in supply chain, I'm not going to paint a beautiful picture, of course, they did it both. And so I think that in itself proves how successful this organization was deploying Workday. And then I think the third piece of it is we were able to gain a transparency across finance and HR and supply chain that we hadn't had. And it was pretty immediate. So we came from older systems that were predominantly manual and paper-based. And the immediate, once you flip that imaginary switch, there's no actual switch when you flip a Workday on. Just to make that clear. But when we flip that imaginary switch, you immediately get, you know, vision into your processes and what's going on and what's being held up and who's holding it up. And so, and the reporting capabilities are amazing. And so the fact that we were able to achieve some of that day one out of the gate makes it a huge success in my mind. So, you know, as I mentioned, was it perfect? No, we have lots of issues. We still have lots of issues that we're working through. But if you look at the whole picture, to say that our organization went from pigeon carriers, if you will, to a completely cloud-based, modernized workflows as an organization in the middle of a pandemic is incredibly impressive. And that is because of the work that our team did, and then the partnership with you all and Workday.
Can you talk a little bit about outcome metrics as it relates to adoption? You think about the ultimate measure of the system is it working, but are people using it, and are they delivering the best care and managing the business the best way through that system? So talk about the outcomes that you drove through adoption.
Yeah, so, you know, again, this implementation was a little bit different. So typically when we bring a big system live, we have success matrix or metrics outlined, and we distribute that across the system, or the leaders of the system, to say, hey, this is what, you know, people are using the system for, or criteria, or whatever the case may be. And so we actually, day one of the implementation, which was a Sunday for us, we had those metrics outlined, and we pulled those reports and we kind of sent them out to leaders saying, hey, look at all these people that are using the system. Isn't this great? And we started to, what I realized at that point, and that's because we really went live when we were doubling down on everything COVID, right? So I kind of said, you know what? I'm not going to distribute these very far. You know, obviously we need to make sure that we're doing all the right things and the system is getting adopted, that we've just spent all this time and money on, but I'm not going to distribute the numbers widely, because again, we want folks to feel comfortable focusing on everything COVID and not worry about, are people using Workday that they should be. What I can tell you is we did still run those numbers every day. So we had pretty quickly, and thanks to the idea to say, hey, we should have a day one activities checklist to motivate people to go in and validate their information and update the system with items that we did not have. So we really tried to push that as much as we could, recognizing COVID changed our communication strategy quite a bit as we went into the implementation. And so when I think about that, I was expecting a much lower acceptance of the product. I wasn't expecting so many people to log in on day one, day two, the first week, if you will. But every day as we ran those numbers, and Jarrett remembers as I was saying, hey, we got 250 people logged in today. So we definitely looked at the number of people who were logging in, how they were logging in. So we, again, had a mobile ability with Workday that we had not had with our past systems. So it was really interesting to see how many people downloaded it onto their mobile application and were logging in that way. And then in addition, we also were looking at what business processes they were using, and kind of how many things were sitting with certain leaders, which was really interesting as well. And I will say that our numbers steadily grew every day. And they've actually plateaued, but that's because we pretty much have 100% adoption, or pretty darn close to it, which is, again, super impressive in my mind, and just shows the value that the system is bringing, which is good news. Well, one thing that I will bring up that I know, one of you had just mentioned was the supply chain component, showing the level of partnership. I think it was actually also a Sunday morning. We had a call from senior leadership to say, does KPMG have any expertise in this? And so it wasn't about Workday at all. It had nothing to do with Workday. It was more of do you have experience in purchasing PPE equipment this way? I think anybody who works in the healthcare industry knows what challenges any healthcare organization experienced while ordering PPE equipment. And we were trying any possible way and just, again, brainstorming how can we become a little bit more creative to get PPE and to make sure that our colleagues are supported in that. And I can remember it was definitely a Sunday morning, and I was paged in to kind of say, hey, do you think we can get a call with KPMG? And I remember being like, I mean, it's Sunday, but we can try. And sure enough, within an hour, we had experts from KPMG on the phone with us, just brainstorming a little bit to say, how quickly could we stand up XYZ? Would it take an hour? Would it take months? Because if it's in the hours timeframe, we want to do it and help us do it. If it's in the months timeframe, forget it. We'll revisit it next time. So I think that shows the partnership that we also had, or that trust to say, hey, do you guys have any experts and how can you help us? So not directly related to Workday, but because we were going through the implementation, and because we had built up that trust to say, do you have any experts? And that was huge for us, and a great partnership moment, I think, for us in general.
Mary, thanks for that. I think you mentioned the importance of the team in overcoming the natural challenges of any sort of a large-scale deployment like this one. But you can multiply that by 10 in terms of complexity when you take that massive change and you couple it with or add to it COVID. Talk a little bit about, beyond the team, what other tools, what other processes did you find helped us overcome the challenges of going live remotely?
The ability to be entirely cloud-based, whether it was the screen sharing, Workday itself, the PES product that we did use, all of those kind of virtual items allowed us to work virtually, collaboratively, all that good stuff. I think also the ability to, or the team on the KPMG side and the Workday team to come to the table whenever we needed them to is a big piece of it. So there were times where I know our payroll folks were on the calls with KPMG until wee hours of the morning. I mean, like way past midnight. And so those are the things I think, if we weren't able to be virtual in that sense, I think that would have hurt us. And I think the ability, or our team's willingness, both at South Shore and KPMG and Workday, to say, we are okay being on the phone until this hour, because sometimes it might take a little bit longer when you're remote. It's easier quickly to whiteboard something all together and figure it out. And sometimes it just takes a little bit longer when you're virtual. So I think that willingness to do those things, I think, is a huge benefit. I think too, the ability for us to be transparent. So when we disagreed on an approach to something, or the way that we were handling something, or the way something maybe was designed that we didn't necessarily think it was that way, I think that ability to have that conversation and to kind of banter back and forth, if you will, was helpful for us. And so that's another kind of, I know you're asking me specifically about tools, but I think having that partnership in the implementation of somebody to just bounce ideas off of and say, that doesn't quite sound right to me. Can you, talk to me more about what that looks like? Jarrett, I know, is very familiar with that because a lot of my comments. But I think that having that ability to just use you as a sounding board and not necessarily, and you guys know this probably better than everybody, I'm not easily convinced of things. Being able to challenge me and me to challenge you, I think is a huge win for any organization that's going through a Workday implementation. And so when we think about the tools of what worked well, yes, having everything virtual helped make it the way that it was. And I think if you think back even 5-10 years ago, most things were on-prem, and you needed some sort of presence in order to make sure that it was successful. That's just not the case anymore. We're able to take phone calls from our laptops. We're able to, share a whiteboard electronically. And so because we had the ability to do those things and we kind of check and adjusted the way that we might not like it, it might not have been the easiest. And having you as a continued sounding board, I think helped us in the long run.
We talked a little bit about the new normal. So you've gone through something big and difficult successfully. How will this experience change the new normal for you in terms of ongoing work at South Shore Health?
Yeah, that's a great question. I'm not sure everybody knows what the new normal looks like. What I can tell you is we are planning more day by day now than we ever were. So, I think earlier you mentioned, I'm always thinking 5 steps ahead of kind of what does our world look like? What issues are we going to run into? Those types of things. And while I'm still trying to do that, I'm not sure we know where the kind of our role in the healthcare world will play out. So I think we take it day by day and we figure out what does that look like. I think this experience has definitely proven that the virtual model can be successful as long as you have the right support and plans in place. So I think if we had just gone into it and been like, we'll see what happens and hope for the best, I think that would have been a very different experience. So I think we have proven that the 100% virtual model can be successful. And that to me means the world, because that has changed how we can do big implementations like this. That elbow to elbow doesn't necessarily have to be there, even though I still don't know which one's my preference. But I will say we've proven that it can be successful. So I think that changes the way that we do business in general. And the fact that everybody can work remotely in these settings to do this work is huge. I do still think we're not exactly sure what the new world looks like for us. But as we take it day by day and we learn more, that will definitely shift the way that we do work in general.
Mary, thank you for talking a little bit about the new normal. Now you guys are through your deployment stage and you're done with most of your stabilization. You talk about how you're continuing to partner with KPMG remotely so you can optimize the system and really realize the full value of Workday and everything we've implemented.
Yeah, so we are officially live, if you will, which is awesome. We are officially live now also with Adaptive, which is Workday's budgeting and forecasting tool. And so we've partnered with KPMG to provide additional support as we go live with that. So we are in the budgeting cycle for our organization right now. And so we realized that even though we went live with finance and supply chain, we needed additional support to make sure that we were covered. We understood how that budgeting process would work in Adaptive and how that information would flow to and from Workday. So we are engaged from a Adaptive perspective and it's going really well. And we're really excited to have our first budget in Adaptive. So more to come on that, but that's kind of one piece of the engagement. The second piece of the engagement is as we went live and we planned for go live, and I remember it was probably a couple days even before go live, me coming to KPMG saying, we're gonna need some help after live. I'm pretty confident that we're gonna have some issues or some follow-up, some major optimization lists in the following areas, but let's go live first. Let's see what the volume is, where we have issues, because as I mentioned before, we don't know what we don't know yet. So as we experience them, we'll come up with a game plan. So as we went live and we kind of stabilized a little bit and figured out where we needed the most assistance, then we worked with you all to come up with a plan that worked well for us. What's interesting, and I'm sure if there are other healthcare folks out there joining, is we as an organization were dealing with COVID. And so we had to, obviously in all that we do, but more so now, be fiscally responsible and good stewards of our organization to make sure that, again, the number one priority is our patients and the colleagues that care for those patients. And so we want to focus on everything that's needed for them. And so it was coming up with something that was reasonable with you all to support us and make sure that people were adopting the system, using the system, and we didn't have issues and we didn't have people worrying about how the system worked. So there were a couple of areas that we said, these are areas that we really need assistance, further assistance from KPMG to make sure that we're confident in our support of the system. And we based that on what was critical for the initiative and what was going to kind of be the best bang for our buck, if you will. And we were able to be flexible with you all, and you all came to the table to say, okay, what about this? And it was kind of going back and forth to find that right balance of what we really, really needed to make sure that we were successful and are successful versus maybe what could we wait on for a few months or a year or whatever the case may be. So we have a couple of different teams that are engaged, not all of the products that we deployed, but the ones that we hadn't necessarily had a ton of experience in. So the example I'll give you is for finance and accounting. With the implementation, we had only been through 2 month ends, and we just didn't know what we didn't know. And we wanted to make sure that we had additional support in the event going through additional month end closes. So we kept on additional support to answer those questions that we may have or correct those issues that we may experience. And we couldn't predict them because we didn't know what we didn't know. So those are some of the examples that we kept on additional support and worked with you all to come up with what the game plan was for that.
As you think about ongoing support, it has to be cost effective. Mm-hmm. And we, like you, want to be good stewards of our clients' resources. Talk a little bit about the experience you've had with our offshore team that enables us to be cost effective. How has that gone?
Yeah, it's gone awesome. So I don't have enough good things. So I hope they're all watching. Hi. But I really enjoy working with, to me, and I am a big proponent of this, regardless of where you are in the world, as long as you're supporting us in the way that we feel appropriate, that's what matters. And so the offshore resources are more cost effective, which is great, but they're at the same level of caliber in my experience thus far as the folks that are onshore. So I will say that I have nothing bad to say at this point in time. I'll revisit that if I need to.
We know you will.
But no, so far it's been great. They've been engaged for, I guess, about a month now, maybe a little bit less. And so it's been a great experience, and they're available. They join phone calls and WebExes with us. They exchange emails with people who work for a health system, not even on the project team. And they're professionals just like you and I are. So far it's been a great experience, and we're enjoying it so far.
Good deal. Thank you.
Yeah.
We hope you enjoyed KPMG's LinkedIn Live discussion with Mary Dolan and our overview of some of the key trends that we see in companies responding to the many challenges of COVID. All 4 events will continue to be available for replay on KPMG US LinkedIn Live page. And we invite you to connect with any of our speakers with follow-up questions, and we hope that you reach out to us. Thank you.